Hi, my name is Olivia Shasho, and I'm going to be doing the video validation for the nasogastric tube maintenance. So to start, I'm going to do my 7 steps. I'm going to check physician's orders, wash my hands, gather my equipment, introduce myself to the patient, identify the patient, provide privacy, and explain the procedure. So we're going to raise the bed to working height. And we're also going to make sure it's at 30, the head of the bed is at 30 degrees. And I'm going to be turning off the suction for the NG tube. It's off. Another thing that's important, I'm going to put down a protective pad because we don't want to soil the patient's bed while doing this or get any stomach contents on the patient as either. So I'm just going to put the protective pad there. We're going to check, because the nasogastric tube, one of the dangers is it coming dislodged and ending up in the lungs. So that's why when you put it in initially, you always take an x-ray to ensure that it's in the correct place, the stomach. We then secure it with tape, and you just want to make sure the tape looks like it's in good condition. We can see here the tape looks pretty new. It doesn't look like the patient has been tugging on it. So that's a good sign. You can also check, there's usually markers on the tube. You can check to make sure that there's the correct amount and check it with the previous chart. So it looks like we're in a good spot. So I'm gonna wash my hands and I'm gonna put my gloves on, and we're gonna auscultate to make sure that we're in the right spots. Okay. And this is not a sterile procedure. It's just a clean procedure. So I'm going to make sure I have 20 milliliters of air in my syringe. I'm going to put my stethoscope on. And we're going to kink this here, remove it, and I'm going to place it on the protective pad. I'll then take the 20 cc's of air, put it in there, and we're going to use the stethoscope. I'm going to put it to the left of the xiphoid process, and we're listening for a swishing noise. Swish. Yeah. Okay, so we heard the swishing noise. That indicates the tube is in the stomach. Next, we're going to draw back a little bit, get some stomach contents, and check the pH. I have a pH strip here right now. I'm going to kink this so nothing spills out, and put a little bit on the pH strip. We're checking to make sure that the pH of the stomach is under 4. Looks like it is. And so now we're going to instill 20 mLs of water into the stomach. So you want to hold it vertically and slowly instill into the stomach. Once you've done that, you're going to pull back 20 milliliters of stomach contents. You're looking to assess for color, odor, particles, and consistency. So you're going to note that this does not get reinstilled into the patient. You're going to remove it and put it and discard it. Once that is done, you're going to reconnect to suction. Turn the suction machine back on. You can remove everything from the patient's bed that you were using. Lower the bed back down to a safe height, which is lowest position. And make sure they have a call bell and everything that they're comfortable. And then what you would do is you would rinse this out, leave it in the container, and label with the time, date, and the patient's name. This can be used for 24 hours. And then I would wash my hands and document, color, consistency, odor of the stomach contents, how the patient reacted to the procedure, and anything else of note.